I want to bring in Professor Perry Halkitis now, epidemiologist and dean at the Rutgers School of Public Health. Professor Halkitis, obviously there has been a spike in cases in New Jersey, which had gone through like a big crush right back in April. And now all of a sudden spiking again. We have the chart curve starting to go back up again. And the rate of transmission, and perhaps this is most crucial, in New Jersey is as high as it has been since April, when you had so many cases and so much death. What's behind this?
Well, I think what we're seeing throughout the country is that human behavior is undermining our efforts to curtail this epidemic. Individuals are out. They're not taking responsibility for their fellow citizens. They're not wearing their masks. They see the sun, they see the beach, and as a result of that, the virus is spreading wildly.
So, the Governor Murphy in your state has announced further restrictions on indoor gatherings, right? He's done some things. You heard him there talking about the actions of some knuckleheads, as he called it. But what happens next? I mean, is it going to be a big, not just a pause, but a big step back, possibly? I mean, we've seen what's happened to states of the South and to the south of New Jersey, right? Big increases. Is a lockdown coming again?
Well, unless people change their behaviors, a lockdown may happen again. I like the term that he uses, knuckleheads. I like Governor Murphy's term. I call it irrational operators. We believe that human beings make choices based on wise decisions to take care of their health, to take care of the health of the people around them, but they don't. And their emotions take over, their feelings take over, their desire to have a good time takes over. They are acting like knuckleheads. And so unless human beings in my state and in other states throughout the country, which I think have similar patterns, begin to actually acknowledge that this virus exists, begin to continually engage in behaviors like wearing masks, washing hands, avoiding close contact with people, we're going to have to see further restrictions in our society in order to be able to prevent the deaths that are inevitable otherwise.
So when I spoke to Governor Murphy in late June, New Jersey's curve had flattened significantly. And here's how he described the situation to me on that day.
We've beaten this virus down to a pulp in New Jersey with an enormous loss of life. We've been through hell and we don't want to go through hell again.
Do you think that may have been premature?
I think that we lived through a very tragic moment in our history, and then with tragedy comes change in behavior. People have very bad memories. They forgot what was happening in April. They forgot what was happening in May. And so I don't think it was premature on Governor Murphy's part. I just think that people tend to forget the bad. And so when we think coming back to this idea of human behavior again, how many people are prescribed antibiotics for 14 days and take them for 7 and then stop taking them? How many people are intending to go to the gym for 5 days a week and do not? Here's the same thing. We need people to wear their masks all the time, to distance, and we need to remind them that death is a reality.
Well, and the reality of it is, right, that there is going to be death. That this isn't,
yes, correct.
In that sense, it is so very different. Thank you very much, Professor. I appreciate your time.
Thank you.